Okay, well, good evening. My name is Jacqueline McDaniel, and I am the Executive Director for the Oklahoma Alliance for Healthy Families. On behalf of the Alliance, I want to thank you for joining us. There is still time to invite your family and friends who may not know about tonight's event, so please just hit the share button. When the Alliance started about 3 years ago, we set out our mission to simply provide education around vaccines. Over the last 3 years, we've partnered with dozens of organizations to bring science-based information to Oklahomans and Oklahoma leaders. About 28 million children ages 5 to 11 in the US may soon be eligible for the COVID-19 vaccine. Approval of the COVID vaccine, like others, goes through a rigorous process of looking at all the data by scientists and medical experts. The U.S. Food and Drug Administration's advisory board will be meeting tomorrow to discuss whether the COVID vaccine should be authorized for this particular age group. If the FDA advisory board votes in favor, they will then make a final decision about whether that will be authorized. Then the CDC's Independent Advisory Committee meets November 2nd and 3rd and will vote on whether to recommend it. Finally, the CDC will decide whether to accept or modify the committee's recommendation. Once the CDC signs off, children ages 5 to 11 should start getting the COVID vaccines immediately. COVID has disrupted our kids' lives. It's made schools more challenging. It's disrupted their ability to see friends and family. But overall has put so much burden on families. The COVID vaccine for children 5 to 11 years of age allows us one step closer to return to sense of normalcy. So we can take off our masks and enjoy the holidays with friends and family safely. We recognize that families are being tasked with making a monumental decision and have many unanswered questions about safety of the vaccine, what to expect afterwards, and where to go to access those vaccines. So we know that COVID-19 is usually milder in children as compared to adults. However, some can still get very sick and suffer complications from COVID-19. This is a judgment-free zone. So today we want to be able to provide accurate information and resources on COVID vaccine, and also to encourage parents to talk to their healthcare provider so they can make the best decision for their children. So with that, I'd like to introduce Dr. Calin Kirk. Dr. Kirk graduated from the University of Oklahoma before attending medical school at University of Oklahoma Health Sciences Center and graduating from OU School of Medicine in Tulsa in 2015. She completed her residency in family medicine at OU Tulsa in 2018. She currently practices full-time at Cherokee Nation in Jay, Oklahoma. She enjoys providing care for the entire family and focusing on prevention and wellness. Dr. Kirk is married to a public school teacher and coach, and she has 2 beautiful children. In her free time, she enjoys traveling, being outside, whether it's the lake, in the woods, or on the ball field, and spending time with family. So Dr. Kirk, thank you so much for joining us today.
Thank you for having me.
So thank you all who submitted questions prior to today's event, and we will get to as many as we can. Feel free to post your questions in the comments as well. We encourage questions and open discussion. However, we do adhere to a be nice, be respectful policy. Any comments that do not align with that policy may result in participants being removed or banned. We are live today, but the Q&A will be posted right here on our Facebook page as well as on our YouTube channel. Please feel free to share. And so with that, we will get to our questions. So Dr. Kirk, first question, why do children need to be vaccinated if the severe illness and death in 5 to 11 age group is so rare?
So kind of like other vaccines, healthy kids are going to have more mild illnesses, but we never know which kids are going to be the one that gets the more severe illness. That is, a benefit. Also, we know that not everyone mounts a full immune response. Some people have, conditions going on that they're not able to get vaccinated. And so the more people that we're able to get vaccinated, including our children, helps us protect everyone around us as well.
So what should parents know about the COVID-19 vaccine for children? What are the risks and the benefits for this particular age group?
So based on our studies, the kids really weren't having much more side effects than what we saw in adults, having some fever, some chills, some, soreness at the injection site, but really weren't having any more severe or different symptoms or side effects from their vaccine. And now we do know from that 12 to 17 age group that was approved for Pfizer, that some children were having mild cases of what's called myocarditis, or an inflammation around the heart. Um, all of those kids, some of them had to be hospitalized, but only for a brief period of time. And that was a very rare event. But most, recovered on their own at home. Because of that, they found the lowest, safest, but still effective dose for the 5 to 11 age range. So instead of the 30 micrograms that adults and adolescents are getting, the younger kids, we're looking at a 10 microgram dose, so a third of the dose. They did monitor for myocarditis in the studies, but there weren't necessarily enough children in the studies to find one of those. We know that about 75 out of 10,000 people got the myocarditis with the vaccine, so we just didn't have quite enough in the studies based in the time frame to actually find one of those during the study, which is good. We know it's not going to be more frequent in this age group. That is one of the things that the FDA advisory committee will look at, is how many hospitalizations and deaths are prevented from these vaccines for every one patient that had that serious side effect of myocarditis, and they'll make recommendations based on that.
Okay. So people who have been vaccinated are still getting COVID and going to the hospital. So why should someone even get the vaccine when it seems that it doesn't work?
So even though we do see some of what we're calling breakthrough infections, where you're fully vaccinated, but you're still exposed to COVID and end up either with a mild case or a little bit more severe case that does cause a hospitalization, we're seeing that a lot less frequently in the population that's vaccinated. We're also seeing a lot less deaths in that population. Even though it seems, because it is a breakthrough, it's not a 100% vaccination, so there are always going to be some of those breakthrough cases. The vaccines are still working really, really well, but that's also part of why they looked at the third doses and the boosters for patients that are at higher risk.
So if other family members are already vaccinated, right, and our children are healthy, why should we vaccinate against COVID?
So just like we were kind of talking about with those breakthrough infections, some of our family members that are older or have chronic conditions, they may not mount as strong of an immune response to those vaccines. And so the more layers of protection that we can put around our family members, the better. So your children are less likely to bring COVID home to grandma, who, yes, is vaccinated, but maybe doesn't have the same immune response that a younger person would. So it's kind of that same thing, as just, everything that we can do to put another layer of protection between COVID and our families is something that we should really think about doing and talk to our healthcare providers about.
So I understand the need for COVID vaccines, but do I still need to vaccinate my child for chickenpox or polio? I mean, these diseases, we don't see them anymore. They don't exist.
Yeah, absolutely. So the reason that some of those things are so rare in our communities now is because of vaccination efforts. When I was in medical school in 2012 to 2013 range, they told us you may never see a case of chickenpox in your careers because it's become so rare. Whereas this same group of people in medical school all had chickenpox when we were younger because it was very early in the vaccines. We may not ever see a case of it. And there's a lot of pediatricians and family medicine doctors out there who have been practicing for years and years and have never seen a case of measles or mumps or polio or even chickenpox. And so that's proof of the effort of these vaccination campaigns. And if we want to get rid of COVID the way we have these, then vaccination is one of our best shots.
Okay. So we're all expecting vaccines specifically for this age group, 5 to 11. Can a 4-year-old get vaccinated?
So not yet. Wait until that 4-year-old's 5th birthday. I've seen plenty of people who on their 12th birthday, that was part of their birthday present was their COVID vaccine. So that might be for their 5th birthday. They didn't really look at it based on weight or things like that, because we know some 4-year-olds are a little bit bigger than some 5-year-olds. But it was more about the immune response of the child, and based on the safety data that we have available. So we're holding out hope that maybe by early next year, we'll have the younger ages doses available as well. But otherwise, it's best to probably wait until we have the full approval, the full safety data for those ages.
Okay. So then the next question is, when will a vaccine be available for children 4 and under?
Yeah. So the good thing is that Pfizer has come out and said that they're looking at data for 2 to 5-year-olds, and then also 6 months to 2-year-olds. And they're expecting to submit some of that data to the FDA by the end of the 4th quarter, which would be in December. So hopefully around Christmas time, they will be submitting data, and then it'll go through that same process like these have, where they have to go through the process of the FDA meeting on it, ACEP meeting on it, CDC taking recommendations. And that takes several weeks, anywhere from 4 to 6 weeks to really review all that data. So hopefully by Valentine's Day, we'll see something for those kiddos.
That's exciting. So here's another question is, my child is not old enough to be vaccinated, and it appears the infection numbers are going down. Should we still be taking precautions, and what other steps can we take to protect them?
So kind of the same kind of plug that we do for the flu shot. If your child is too young to be vaccinated, and not just the flu shot, but the varicella or chickenpox vaccine, the measles and mumps vaccine, for those kiddos that are too young for that, our best protection is having everyone around them vaccinated. So they kind of make a bubble around that kiddo. So the best thing would be to get everyone who is eligible that they come into contact with vaccinated. Wearing masks out in public, and when you're wearing a mask, your kiddo is more likely to comply with that too. And then just doing the best that you can to social distance.
Okay. We had a comment, someone said, Catherine says, I can't wait to get my kindergartner vaccinated. This makes me feel much better about the low risks for side effects for my children. Thanks, Catherine, for joining us. So can children with underlying conditions or asthma, for example, can they be vaccinated? Oh, there you are.
Okay, I'm back. I'm not sure what happened. So if I caught your question, heard something about kindergartners getting vaccinated, and then something about children with like asthma or other conditions.
Yes. So can children with underlying conditions or asthma, for example, can they be vaccinated?
So that is something to talk with your kiddo's personal healthcare provider, their doctor, about. But for the most part, we expect that yes, they can. And actually, kiddos with underlying conditions like asthma or diabetes or other autoimmune conditions should really be vaccinated, because they're at so much higher risk of severe illness with COVID. So talk to your doctor about it. But for the most part, I'm going to think that they're going to tell you yes, just like we do with all the other vaccines. And my kiddo is in kindergarten as well, and we have been waiting for this vaccine. He asked, when we got ours, he asked almost every day, when can I get mine? When can I get mine? So we're excited for him to be protected in a couple of weeks.
That's great. So what if a child is sick right around the time they're supposed to get their vaccine? How long should they be symptom-free before getting vaccinated?
So I would make sure that they're not sick with COVID, because as we've seen in some adults, that if they're still having some symptoms from their COVID infection, even if they're out of their isolation period, they may have a little more severe side effects with the vaccine. So just make sure they're feeling back to themselves after COVID. As far as other illnesses, as long as they've been fever-free for 24 to 48 hours, it's usually advisable that they're okay to get the vaccine, but that's something to talk to their healthcare provider who's giving the vaccine.
So what about other vaccines, not just COVID? So just regular routine childhood vaccines. Is there sort of a time frame for when kids are sick that they shouldn't be vaccinated?
Typically, as long as they're 24-hour fever-free, I recommend them go ahead with their vaccines. But once again, something to talk to your doctor about. But the less time we can put off any of those vaccinations to protect the kiddos, the better.
So question we had is, I plan to vaccinate my child against the flu as well as COVID-19. How much time should I wait between the routine vaccines for kiddos? Um, or is it safe to give it to them at the same time?
Okay, you kind of
Did I cut out on you? Okay.
rural internet. So so I think I heard asking about mixing vaccines or getting routine vaccines at the same time as COVID.
Yep.
There hasn't been a specific recommendation as far as children go just yet, but as far as adults go, we have said that it's okay to get those routine vaccines at the same time as the COVID vaccine. So right now is prime time to get your flu vaccine. Don't wait to get the flu vaccine until the COVID vaccine comes out for kiddos. Just go ahead and get your flu shot, and it's not going to prevent you from getting the COVID shot when it's time. So no need to delay or spread those vaccines out.
Okay. So the holidays are around the corner, and I know that I can't wait for my kiddo to be around friends and family, and I'm sure other parents feel the same way around this special time of year. How long should we wait to celebrate with family and friends once vaccinated? And should we still wear masks even after that?
Yeah, so this is going to be a little bit different based on everyone's comfort level and based on what conditions other people have and how many of the adults in attendance are vaccinated. Still kind of like in the past, if you can celebrate outdoors, if we're lucky to have nice weather on Thanksgiving this year, trying to do an outdoor celebration is definitely going to help with the ventilation. If there's anyone who's not vaccinated or is at high risk for complications of COVID, then wearing a mask is also advisable. And then, we're considered fully vaccinated about 2 weeks after that second shot. And so hopefully by Christmas time, we've got the younger kiddos completely protected as well.
Okay. So in terms of sort of going back to school, right, we talked about Christmas. Is it recommended to continue wearing a mask?
So this has been something too that kind of differs depending on the spread of COVID in your community, the amount of people vaccinated. So once your kid is vaccinated, a mask is still going to protect others around them and also going to provide a level of protection for them. But as long as you're vaccinated and community spread is very low in your community, then probably okay to start to spend some time without the mask. And that's why we want to get such high level of vaccination so that we can get that spread low and so that the more people around are vaccinated and protected.
Okay. So as an adult, I experience some mild side effects. Are there any additional side effects that children might be experiencing? What are they, and can we give them Tylenol, or how can we help with that?
So same thing, like we kind of said before, the side effects seem to be similar in this age group as they were in other age groups. So some fever, some headaches, some body aches, chills, things like that. Another thing that we may look for is swollen lymph nodes. Most of the time, those resolved within 2 weeks. If you have any concerns about any of those side effects, seeing your healthcare provider is always a good thing for some reassurance. You can use Tylenol. I wouldn't necessarily pre-treat just because then it might be an unnecessary dose of medicine. But if kiddo's uncomfortable, it's always okay to give them a small dose of Tylenol or ibuprofen. Shouldn't affect the effectiveness of the vaccine.
Okay. A question that came in is, don't we need information about long-term side effects before we even start giving vaccines to children?
Yeah. So a lot of times we do like to see a little bit more long-term data with a new medication. However, just based on the way vaccines work, we don't always necessarily see anything as far as long-term. Other vaccines are still being studied from, their inception, and there hasn't ever been anything that popped up, decades later from a vaccine. And so that's reassuring. Another thing that, people think the COVID vaccine happened really fast is that we poured a ton of money into it and we had a ton of people willing to volunteer to be in the study groups. which is not always the case with vaccines or other medications. And so it takes time to recruit people into the study. Whereas with COVID, there were people that wanted to be in the study that weren't able to be. As most of my physician colleagues can tell you about our children, we were searching for nearby places and crossing our fingers that the local, research facility was going to enroll kids our kids' age. But unfortunately, we didn't have as many of those as we hoped for. But also, the way these vaccines work is there's an mRNA attached to a little fat particle. It goes in, your cell recognizes this mRNA, makes a code for it, puts that protein on your cells so that your body starts forming antibodies to those proteins. So that if you see the protein on the coronavirus and come into your body already has those antibodies to start fighting it off. We know that the mRNA degrades within 72 hours. So nothing expected long-term from that. And then the fat particles degrade usually within 4 days. And so once again, these are not vaccines that are hanging around in your bodies for, a medication that's hanging around for a long time.
So I've heard this before. And so it sounds like that could be understood as vaccines are shedding. Mm-hmm. We've heard some rumors about that. Is that true? And does someone's child need to stay home from school after getting vaccinated?
So this particular COVID vaccine is not a live vaccine. So some of our live vaccines, like the MMR vaccine or varicella vaccine, we do sometimes worry about that with, but not in the way of shedding and promoting disease, but that your body may have a small, infection from it. But the COVID vaccines are not live vaccines. And so all it is giving your body a code to how to make an antibody to fight it. So no, there's no reason to stay home after school unless they're just not feeling well, side effects from the vaccine for the next 24 hours or so. But no concern about the shedding. And I know we talked a little bit about family members that have other conditions, and if kiddos vaccinated, do we stay away from those family members for a certain amount of time? That's going to be a discussion with like their healthcare providers if they're on chemotherapy. Sometimes they don't want to necessarily have interaction with anyone that's been vaccinated, and it's not necessarily because of shedding, just more so just that their immune system's so weak that they need to be safe around everybody at the time.
Okay. So will we expect a booster for children in the future? And how often?
I'm not sure yet. That's going to come with some more data. Just like with adults, we didn't necessarily expect a booster to start. But as we saw, new variants emerging, hospitalizations increasing again, that's when they started looking and saying, okay, do we need to, boost everyone's immunity against COVID? And so we'll just have to kind of wait and see what the long-term, how long the immunity lasts with kiddos. And they did have very strong immune responses, anywhere from 91 to 97% effectiveness against COVID. And so it'll take time to see, and hopefully we don't have any more severe variants emerge, so that we aren't necessarily having to look at boosters for kiddos.
Okay, so what happens if, let's just say a child is exposed to COVID after they've been vaccinated? What should a parent do?
So if a child is completely fully vaccinated, that means had both of their shots and then is 2 weeks after their second shot, and they're exposed to COVID, they don't necessarily have to fully quarantine. They do need to wear a mask anytime they're in a public space and be tested anywhere from 3 to 5 days after that exposure, and then monitor themselves for symptoms for 14 days.
We've seen some misinformation around fertility as it relates to the COVID vaccine. So is there evidence or cause for concern for children if they get vaccinated in terms of fertility?
So that wasn't something that was specifically studied, just because there was no direct correlation. There was no reason, the components of the vaccine have not ever been known to affect any type of fertility. That is something that commonly the anti-vax group kind of goes after, because of course we're all worried about reproduction. That's what humans are driven to do, is to procreate. And so that's a commonly used fear tactic that does make people have cause for concern. Like I said, it wasn't specifically studied in children because 5 to 11-year-olds were not worried about fertility in that age, or we don't have a way to study it. You know, we don't have a way to say, okay, these kids weren't able to get pregnant because 5 to 11-year-olds aren't typically getting pregnant. However, in the adult populations, we did not see any cause of infertility, any problems with that. In fact, in the research groups for Pfizer, just as many patients in the vaccine group got pregnant as in the placebo group. And if there was any cause for concern for fertility, we would have expected those numbers to be drastically different.
What about altering your DNA?
So same thing, just like before with how we discussed with the mRNA, it's not plugging that into your cell and changing DNA. That's not how mRNA works. It's just a copy that your body comes in and then, or like a road map for your body to come and look at and then send away. So it's not actually being integrated into DNA or into cells. It's just a roadmap for the body to produce some antibodies for.
Okay. We've talked a lot about COVID vaccine, and we touched a little bit about like other regular childhood vaccines, routine vaccines. Mm-hmm. But with, lots of folks, kids are going virtual. It may have missed regular appointments with doctors, their doctors and well child checkups. Is it okay to sort of like just jump back in and get caught up? And what does that look like?
Yeah, absolutely. Definitely talk to your healthcare provider, but we know that routine childhood immunizations have declined during the pandemic, and for a multitude of reasons. People don't want to take their healthy child into a doctor's office where there might be sick patients. A lot of, doctors' offices were kind of forced to decrease what patients they were seeing and only see sick patients or see patients virtually because, early on in this, we didn't have access to the testing and the protective equipment that we needed. But that has improved, and as in most offices are probably seeing their well childs back in person if they ever stopped. So definitely call and get in for your routine well child checks and get those immunizations caught up because we need them to be protected from all the possible illnesses out there, not just COVID.
Okay. So as a physician yourself, what do you wish parents better understood at this time regarding the COVID vaccine?
I think just the way that having this vaccine for kids is going to help them get back to a sense of normalcy. There's been so many quarantines and canceling of sporting events and extracurricular activities and missing out on traveling and visiting family. And the more people that we can get vaccinated in that child's bubble, the better, and the more that we can get back to our sense of normalcy.
So where can children be vaccinated?
So based on what has been put out so far, there is going to be a lot of different options. The health departments are going to get, especially here in Oklahoma, the health departments are going to get a big shipment. There's going to be lots of pediatric offices. Those orders, actually, I was reading up on, they went in this last weekend. If you were interested in ordering it, their clinics have already put their order in. But they won't receive it until next week after the FDA advisory committee meets. And then once ASAP approves it, then shots can start going out. But health departments, pediatric offices, some pharmacies will have it. And then there will probably even be some community events and maybe even trying to get some vaccines into the school. There is going to be a different vial so that we don't, there's less risk of giving the wrong dose to kiddos. There's going to be a special pediatric kit for the diluent to put the vaccine into arms, and then also special training for any potential side effects. With any medication, anaphylaxis is a possible side effect, but it is a very rare one. But we, of course, still want everyone on site to have training to how to deal with that if it does occur. So as soon as you're ready, as soon as it's approved, get a call to your pediatric office and see if they're giving out the vaccine. And if they're not, where they recommend you go, like whether it's to the health department or another clinic or a certain pharmacy.
So do folks need insurance for their kiddos to get vaccinated? The COVID vaccine?
Yeah, for the COVID vaccine, they do not. If you do have insurance, there may be something that gets billed just to your insurance, but won't have a copay. And that's more just for the administration of the vaccine, for the staffing and that kind of things. But if you don't have insurance, you won't get that as a bill, just like back to state of normalcy. Also with other childhood routine immunizations, if you don't have insurance, then the health department's a great place to go and get those vaccines updated.
I know getting vaccinated for little ones is super, super scary. So as a parent yourself, what do you suggest or that we say and help our kiddos?
Kind of like I was talking about earlier, my now 6-year-old who's in first grade has, seen what's different about school, between wearing a mask to school and not getting to go on certain vacations, or not getting to go to certain people's houses, or having to have, miss a season of soccer or something like that. He has seen, they understand that things are different. And just he understands that, hey, everyone else is getting this vaccine so that we don't get COVID, and so that we don't have to be worried about COVID as much. And so just talking to him about protecting themselves and protecting other people, whether it's mom or dad or a sister or grandparents, that you can kind of make it a personal thing. That I think that helps kiddos a lot, because they still really do care about other people. And then, make it a special treat, just like you would other vaccines. Okay, we're going to go get this vaccine, and then we'll stop and get, some kind of treat that they like, and then spend some time together afterwards.
So we had a question that came in. About 1,500 plus children seems like such a small sample size compared to the data we saw from 40,000 plus, if I'm remembering correctly, from the adult trials. Can you provide reassurance that the sample size was sufficient enough to be able to capture any or all rare side effects in children?
So I touched on this a little bit earlier. They did have a sample size of 4,500 kiddos, and that was across 4 different countries for the Pfizer vaccine for phase 1, which is just a safety trial to say, is this safe? Do we have, serious side effects from that? They have over 2,000 kiddos with multiple months of follow-up data on that. And then they moved on to the phase 2 to 3 trials, which looked at the dose. And that's where we saw, okay, 30 versus 10. Kiddos were still mounting a great antibody response and having less side effects. Like I touched on earlier, the myocarditis that we saw in the 12 to 17-year-old population, and even maybe the 12 to 25 in young male population, it's about 75 to 100 per 1 million cases. So in order to find one case, we have to vaccinate 13,000 people. And so it's just really hard to get 13,000 people into a study between, time commitment, the monetary commitment from the research itself. And so that's what they will look at and talk about. That'll be a big topic tomorrow in the FDA's meeting is, okay, how many kiddos will we prevent from being hospitalized or dying from COVID for every one kiddo that gets an episode of this mild myocarditis? I think it is important to stress that kids are way more likely to get myocarditis, or the MIS, the multi-inflammatory syndrome, from COVID than they are from the vaccine, as much as anywhere from 4 to 7 times more likely. So while it is a rare side effect and can be scary, most cases were very mild, didn't require hospitalizations, and all of them recovered.
I know that I had mentioned earlier that the infection numbers seem to be going down, but we're still certainly in a pandemic. Is there anything that you can add in terms of sort of providing some sort of reassurance in terms of the Delta variant, or anything that is additional variants that folks are talking about?
Mm-hmm. So right now there hasn't been too much popping up on a new, more severe variant than Delta, but the more people that we're able to get vaccinated and protected in this country, the less likely we have those other variants emerging. So if you haven't been vaccinated and you're eligible, then it's not too late right now. Go get vaccinated, because we want to protect you, and we want to protect those around you.
Okay. So where can families ask questions? Who can they go to? I know we've said it before, but
Yeah, definitely
reiterating this.
calling your pediatrician or family medicine physician, whoever your kiddo sees for their well child checks. Talking to, if you have a trusted nurse or physician in your family, that's a good person to go to. But definitely getting in and getting caught up on those well child checks and asking those questions. Any of us are happy to see you and your kiddo and reassure you for anything that your fears are.
Okay. I don't think we've got any additional questions in the chat. Can wait a minute or less than that.
Just another plug too, that it's prime time to get flu shots. We're end of October, and October is a great time to get your flu shot to keep you protected through the full flu, our typical flu season. We did have a lower flu season last year, but we were out of school a lot. We were all pretty much wearing masks at that time, whereas that's kind of decreased lately with all the COVID vaccines. But definitely getting your flu shots so that we keep those hospital numbers low with all kinds of respiratory illnesses.
Or just one last question in terms of pregnancy. So if I get vaccinated while pregnant, will antibodies be passed to my baby before birth? And so what about breast milk in terms of that?
Yeah, so we do know that patients who are vaccinated while they were pregnant, that their babies do have some antibodies. We don't have really robust studies saying how protective those antibodies are, but anything is helpful. And then also the fact that you're vaccinated with your baby at home, you're more protected from COVID, less likely to bring it home to baby. Same thing with the flu shot. The babies under 6 months are too young to get the flu shot. And so it's really important for everyone around them to be protected to help protect the baby. We also do know that the antibodies are passed through breast milk. Same thing. We're not exactly sure how protective they are, but we do know that the antibodies are there. And we also know that babies that are breastfed have less respiratory illnesses, and so breastfeeding, if you can, is recommended. I actually, early on when I first got my COVID vaccine, I was still breastfeeding. And so I collected some samples and sent those in to help with the research to go forward to make sure that they were, if there was antibodies there. And I've actually saved a little bit back in the freezer so that if the 1-year-old, 18-month-old gets exposed again, that I've got some milk to give him.
That's great. So it seems that we have come to the end of our Q&A today. Thank you so much, Dr. Kirk, for your time. Yes. Thank you, everyone who joined us today and for all your questions. As a reminder, we are live, but this Q&A will be posted right here on Facebook as well as our YouTube channel. Please feel free to share with your family and friends who were not able to join us today, but have questions and concerns of their own. It's okay to ask questions. Just make sure that you connect back with your healthcare provider and asking those questions. And because they know your family best.
Yes.
So lastly, we just want to include some resources. I'll be adding that to the comment box to help you find a COVID-19 vaccine near you. So thank you again, Dr. Kirk, and have a good night.